would you like me? I'm going to borrow a chair, too. I'll borrow a chair.
Just to your right, Governor.
Thank you.
Good afternoon, everyone. My name is Dr. Nirav Shah, and I am the director of the Maine Center for Disease Control. Thank you all for joining, and thank you to Governor Mills for being here as well today. I'd like to start by providing an update on the COVID-19 situation across the state. As of right now, the Maine Center for Disease Control is reporting 118 cases of COVID-19 statewide. This reflects an increase of several cases overnight. As of right now, there are 15 of those cases who are hospitalized. 7 cases that we have previously recorded are fully recovered and have been released from isolation. We now, statewide, are reporting cases in 10 counties. The latest numbers include a new county, Waldo County, among the cases that we've seen statewide. Overall, Maine CDC has received 3,185 requests for consultation from healthcare providers across the state. I'd like to just pause there for a quick moment and note that the cases that we detect in any outbreak setting, whether that's COVID-19 or any other type of infectious disease situation, merely represent the tip of the iceberg. There have been questions about whether and to what extent individuals should start taking action. And given that what we are detecting in any outbreak is only the tip of the iceberg, now is the time to start taking public health action. To put that differently, even if you live in a county that has not yet recorded cases, there is no need to wait until your county is on the board before taking preventive public health action. The absence of evidence of cases in your county is not evidence of absence of cases in your county. I'd also like to provide an update on testing across the state. There are now 3 additional commercial entities that are providing testing services for COVID-19 to Maine residents. In addition to Quest and LabCorp, which have already been online, there are now 3 additional corporations or entities. One is the Mayo. Second is an organization or a commercial laboratory called ARUP. And the third is an organization called BioReference Laboratories. So there are now a total of 5 commercial entities that are offering testing across the state. This is in addition to the testing that is offered by the Maine CDC's laboratory here in Augusta, as well as a laboratory affiliated with Maine Health called Nordex. I'd also like to take a moment to discuss the backlog of tests, a topic that we discussed yesterday. As of right now, there are roughly 1,300 tests awaiting running at our laboratory. Let me just say right up at the top, that number is unacceptable to us, and we acknowledge that. The number is a function of 2 interrelated factors, the chief of which is a national shortage in one of the chemicals that is used to make the reaction that is used to test for COVID-19 happen, a so-called reagent. And there is a national shortage of this reagent that has affected laboratories, especially state public health laboratories around the country. The other factor is our focus on the highest risk individuals to ensure that we can return tests to them as quickly as possible. These are folks that are in the hospital or the healthcare workers who may have been exposed and who are otherwise treating people who are in the hospital. We recognize, however, that this backlog number is too high and unacceptable, and here's what we're doing about it. One is that we are working to acquire an additional piece of equipment that will help with the extraction process that is a part of the overall testing process for COVID-19. We hope that that new and different piece of equipment will have a steadier supply of reagents, these chemicals that are in short supply. The other thing that we are doing is working with one of the commercial laboratories that I mentioned to have them help us get results back as quickly as possible. So again, the number that we've got is too high, and we recognize that, and we are working diligently to operationalize a plan to bring that number down as quickly as we can. Finally, the number of negative tests in the state stands at 3,014 as of this morning. Before I turn things over to Governor Mills, I'd also like to provide an update on our continuing distributions of protective equipment. Again, this is protective equipment such as masks, face shields, gowns, and gloves that is used and worn by healthcare providers and first responders across the state. As with the laboratory chemicals, there is also a shortage of this protective equipment. And so our task right now is to distribute this scarce resource in a fair and equitable manner. Yesterday, Maine CDC distributed roughly 22,000 pieces of protective equipment to healthcare providers and healthcare entities across the state. Just to provide a flavor for who received those vital, life-saving pieces of protective equipment. Among the recipients were 68 local fire-based EMS and rescue services, 22 local law enforcement agencies, such as local police departments and county sheriffs, 16 municipal-based emergency medical services, 9 regional hospitals, multiple agencies within tribal nations, and certain state facilities, such as our veterans' homes. Today, Maine CDC is continuing its distribution of this protective equipment and shipping out roughly 16,000 pieces of protective equipment on top of the distributions that were made yesterday. And finally, I can also report that this morning, Maine CDC received its second shipment of PPE from the Federal Strategic National Stockpile, which arrived at CDC's warehouse. I've previously provided the numbers of what's in that shipment. I'm happy to do that again if needed. Finally, I'll just provide a quick update with respect to availability of scarce medical resources. As of this morning, there are 77 total intensive care unit beds available, 248 ventilators available, and approximately 84 respiratory technicians who stand ready to assist. As I close, I'd just like to remind everyone once again that these are difficult times for many people, and we ask that everyone recognize that different people grapple with the stress of scary and uncertain situations in different ways. If you are having difficulties, please reach out. 211 is available. And if you are in crisis, please call the Maine Crisis Hotline at 1-888-568-1112. Please remember that you are not alone and that people can be there for you even if they are not there with you. Thank you very much. I'd like to turn things over to Governor Mills.
Thank you, Dr. Shaw. Thank you for the incredible work you and your office are doing in recent weeks, especially carrying on the vital work of protecting our public health here in Maine. And thank you, Regan, for helping us communicate to the broadest audience possible. I know I speak for countless Maine people when I say thank you for keeping us up to speed on the changing situation with clear information and guidance on how we can keep ourselves and one another healthy. The challenge of mitigating the spread of COVID-19 is one we share with the rest of the world. The solutions we pursue must not be done simply because somebody else did it in another state or another country. The solutions must be right for Maine people and for the health of our people. I've been very grateful for the ways Maine people have met this shared challenge with unique solutions and offers of generous donations in recent weeks. Just this morning, ND Paper, based in Old Town and Rumford, donated 1,000 N95 masks to the state of Maine for our distribution. People have been emailing and calling every day. Everybody with a sewing machine wants to sew masks, and we vet those requests, those generous requests, through Maine CDC and DECD. Right now, LL Bean workers who are not employed in public-facing retail are helping the Good Shepherd Food Bank package food supplies to places all across the state. Yesterday, I spoke with all the tribal chiefs in the four tribal entities in Maine and sought their needs, and we're addressing them. I spoke for the fourth time, I think. I had a conference call yesterday with the vice president. 3 of those calls have been with the president as well, where all 50 governors are on the line and stressing what the states need now, including the shipments of PPEs that we are getting now, and that will continue. We are stressing the financial needs of the state as well to the federal government, and constantly talking with and emailing the congressional delegation, all 4 of whom have been extraordinarily helpful. Right now, Maine Seacoast Mission and other organizations have established drive-through pantries. The Humane Cooperative Extension has created a portal to connect farms with available food to consumers who might access it. The Maine Children's Center in Augusta has partnered with Maine General Hospital to provide child care to healthcare workers. People are stepping up to the plate. Maine Craft Distilling is making and distributing its own hand sanitizer. Who'd have thunk that distilleries could turn into such uses? But they're stepping up to the plate. I'm proud of Maine people. And for those who are interested in donating or offering services or supplies, the state is creating a portal to help you determine the best place to direct those efforts, and we hope to have it live in the next couple of days. It'll be called helpers.gov or something of that sort. Maine people are what sets us apart. Just as we're not like any other state or country or city, and no town or business or family in Maine is the same either. So I have avoided mandating actions statewide and have instead issued strong recommendations for Maine people to prepare for and respond to this virus. And I've wanted to give Maine people a chance to make plans before upending their lives. I've strongly recommended all non-essential public-facing businesses like gyms, hair salons, theaters, casinos, shopping malls, and the like to close their doors to the public to minimize opportunities for social gatherings and groups of more than 10. And that was not an easy recommendation for me to make last week. I know it was not an easy recommendation for many people to comply with. Still, most people did. Today, I'm implementing another measure to mitigate the spread of the virus, to protect the health of our loved ones and fellow citizens, and to safeguard our capacity, the capacity of our healthcare system. As Dr. Shah has explained numerous times, we are trying to prevent an overload on our hospitals, on our healthcare providers at all levels. That is what's come in other states and other countries. We want to try to avoid it here. So this is a measure that several other states, or similar to what several other states have taken, effective tomorrow, March 25th at 12:01 a.m. and for a period of 14 days through April 8th, 12 a.m., I am mandating that all non-essential business and operations of any sort in Maine close their physical locations that are public-facing, meaning those that allow customer, vendor, or other in-person contact. This order also closes non-essential businesses, sites that require more than 10 workers to convene in a space where physical distancing is not practical. This mandates what I had previously recommended for non-essential businesses across the state. This does not include entities that provide essential services that would include food processing, agriculture, industrial manufacturing, trash collection, groceries, household goods, home repair, auto repair, pharmacies, medical facilities, of course, childcare, insurance, banks, gas stations, other such commercial entities. Non-essential businesses, and we're relying in part on the Homeland Security definition of essential services, but non-essential businesses and operations can continue those activities that do not allow customer, vendor, or other visitor in-person contact, or that do not require 10 or more workers to gather in a space where physical distancing is not possible. And they may act to facilitate the maximum number of employees working remotely. So we're not shutting down businesses, we're shutting down public-facing physical plants. For example, an insurance company or a bookstore could close to the public, but still operate, take orders, process claims, deliver goods, and stay open in that sense. State government remains open, but our offices have significantly moved to telework and dispatching from home. They have limited public engagement, and they have required physical distancing within all office buildings. The Department of Administrative and Financial Services estimates that 70% of state government employees are now working remotely. And I want to take this moment to express my deep appreciation to the state employees who are adapting in this new environment, to working still to ensure that we still provide critical services to Maine people. I ask all businesses and enterprises, nonprofits, other entities not listed in my executive order, if you believe that it is essential to do what you do, or that you are an entity that provides essential services, you may request such a designation. And you can request that at maine.gov/essential service. I had also previously recommended that all essential businesses like grocery and convenience stores, banks and gas stations, pharmacies, laundromats, that they implement physical distancing measures to keep their workers and their customers safe. I've talked with the Maine Retail Association. I've spoken with the managers and regional managers of many large stores. And in response to those conversations, I am recommending that they do a lot better. We must do better. I'm strongly recommending that all such businesses who may sell groceries in one part of the store or pharmacy products in one part of the store, that they immediately employ strict strategies to reduce the congestion in the stores. What I'm recommending is for stores with physical retail space of more than 5,000 square feet, limit your customers to no more than 100 people at a time. Enhance curbside pickup and delivery services. Stagger your hours for employees and for shoppers of a certain age, as some groceries are doing now. Close your fitting rooms. This is not the time to shop for clothes. Caution customers against handling merchandise that they're not purchasing. Mark 6-foot measurements by the cashier stations. And remind customers to remain 6 feet apart at all times in and outside the store. Stagger break times for employees and require frequent hand washing. Sanitizing high-touch areas such as shopping carts frequently. I want to be clear. Essential businesses and entities that people count on for basic necessities, like groceries, corner stores, pharmacies, etc., daycares, pet food stores, banks may still stay open, and you, Maine people, will have access to food for your family, your pets, gas for your car, medical care, and medication. But do not go to the store because it feels like a good thing to do. Go to the store only when you really need something, and first call ahead and ask for curbside delivery. Stay away from other people. Just because a store is open doesn't mean it's safe for you to go there. And it doesn't mean you should take your whole family there. It means common sense practices, like make a list and send one person to the store after calling for curbside delivery to get only those things you need. It's not the time for discretionary shopping. It's the time for only essential activities, for essential goods, services, and products. I recognize these decisions create significant difficulties for people and for businesses and entities across our state. And this applies not only to for-profit businesses, but for nonprofits, entities of all sorts. I know people in my community enjoy a Beano game on the weekends at the Elks Club or the American Legion suppers on Saturday night. We can't do those anymore, not for now. The next 15 days are critical at flattening that curve so that Maine stays ahead of this thing as much as humanly possible. We're confronting an unprecedented challenge. Some people have asked about non-Maine people, non-residents coming to our state. I know that, at least anecdotally, this is an action. Know that I cannot just close the borders of our state. Constitutionally, I'm not entitled to do that. The traffic patterns from the turnpike do not reveal a huge influx of traffic. But for those people who may be subject to orders in other states that require them to stay in place, and if they believe they can escape that by coming here, if they believe they can escape the virus by coming here, they are wrong. They cannot escape it because it is here. It is everywhere. And regardless of the state of residence, your state of origin, our laws and orders and guidances apply here to everybody, to visitors and residents alike. You should not be traveling to Maine to take an early vacation. You should not be participating in any gatherings of more than 10, and for that matter, fewer than 10, it can be very difficult too, space-wise. Don't get together closely with other people. I urge you in the strongest possible terms to engage in physical distancing at all times in order to protect your health and that of your families, loved ones, and fellow citizens. To the people of Maine, I am consulting with the Maine CDC, with clinicians and health systems leaders, with other states, with our own coronavirus response team to examine all options every day, including the various actions taken by other states. These discussions are ongoing, and we focus on three different things. Will an action effectively protect the health and safety of Maine people? Secondly, how will it impact the day-to-day lives of Maine people? And are those impacts outweighed by the benefits? 3, are the long-term consequences of such an idea outweighed by the short-term gain? How do we balance the need to keep people apart with the needs of someone who needs dialysis or cancer screening and having to delay some of those things or forego care, and the potential for people no longer donating blood amid a severe blood shortage? something I plan to do as soon as possible. These are the types of considerations that weigh on my mind as we consider the possibility of even more restrictive orders. I hope we can avoid taking further steps, but it depends on our collective actions. It depends on not only our most essential businesses staying open and those who do stay open, implementing physical distancing measures. It depends on Maine people staying away from groups and standing 6 feet apart from others in any circumstance, indoors or outdoors. I was asked this morning about pickup basketball games and baseball and sporting events. And those do engage in physical contact, and you got to avoid that. I'm sorry, I know it's fun, and it's what kids enjoy and people of all ages enjoy, but we've got to prevent that for now. Depends on whether we choose to stay apart today so that we can come back together tomorrow. I urge all people to take seriously the threat of this virus and to practice physical distancing. I also continue to urge all Maine residents who are considered at higher risk, such as older Mainers and those with underlying health conditions, to limit social interactions as much as possible. But staying at home whenever possible, staying apart from one another, we may be able to avoid taking other more drastic actions. God bless you and keep you and yours, and God bless the state of Maine. Happy to take questions, and I think Dr. Shah has a lineup.
Great. So we'll take some questions in here. There are 3 folks on the phone that we'll turn to in a bit, but we'll start with questions here in the room. Steve?
Quick question on the testing and the equipment you're considering buying. My understanding is, can you tell me if that's, is it Flygen? Is that the reagent you would be using for the additional equipment if you did purchase it, or is it different?
So Steve's question is, if we purchase new equipment, what reagent or chemical will it use? This might one of the things that we're concerned about is that if we purchase this equipment, other states may do so as well, and we are concerned about a high demand on that. And so, for the time being, I'm not going to note the brand of the piece of equipment that we are considering purchasing. The piece that we currently have, the equipment itself is made by the manufacturer QIAGEN, and that's the one we have right now. The reagent, the chemical that is in short supply, is manufactured by Roche, as it turns out. And again, for reasons of wanting to just make sure we manage demand, the machine that we're thinking about purchasing is made by a separate manufacturer. It is fully FDA approved, so on and so forth. So not trying to be opaque, but we're concerned, and we're trying to manage the supply chain so we don't find ourselves in the same situation a week or two from now. So, Don, and then we'll go to the phone.
To the governor, 2 unrelated questions. One simple: are you going to have the Maine income tax deadline shift to the federal change that was just announced?
Good question. Oh, go ahead.
And the other question is about what you just announced. Did you consider taking tougher steps at this time?
We're considering all kinds of steps every hour on the hour, frankly. Some states have looked at what people can't do. I'm looking at what they can do and how to minimize physical contact within the parameters of what they can do. Maine is different from other states. We're the most dispersed population of any state in the country. Sometimes that's bad, sometimes it's good. We've talked about state parks, talked about the beaches. We've talked about what local entities and municipalities are doing in their own locales, and their needs are sometimes different from one locale to another. Likewise, the needs of one state are different from those of other states. Connecticut, Illinois, New York, Massachusetts, Pennsylvania have all in California, for instance, and have taken different actions in response to different urgencies and different densities of population and different kinds of gatherings that they tend to attract. So we're looking at all different options at all times, but this is the action I choose to take today to address what I perceive as what people are doing that they might not want to do in coming days and weeks. In terms of the income tax filing deadline, I'm disappointed. I think most state governors are not particularly happy with the federal government's action. We are conferring among ourselves and with our own treasuries and revenue services about what we can do, how we can accommodate the federal government's extension without sacrificing state finances overly. So we're looking at that. Have not made a decision about the April 15 deadline, which is now in effect in Maine.
Great. Could we go to Nick Zambides from the BDN on the phone?
Is this a speaker? Nick?
Nick, are you there? Okay, we'll try to come back. We'll try Kendra Caruso from the Republican Journal. Okay, we'll go back to the room. Yep.
Governor Mills talked a little bit about people coming in from other states, and I wanted to talk a little bit about the airports and what sort of screening protocols are happening.
Airports.
We're hearing from people about, coming in off of planes.
Can't hear you very well. I'm sorry.
So one of the things we heard is that the plane landed at Portland, 6 people got off with symptoms and immediately went to an urgent care clinic, and that was concerning. And I didn't know if these are the kinds of things you were hearing, and whether or not there needs to be any sort of precautions for people coming in through the air.
Well, an airplane, by definition, is a fairly crowded situation, and I would discourage that. I'm not familiar with the particular actions you've just described, but happy to look into it, take follow-up action.
Great.
Governor Mills, what would it take for you to order?
I'm sorry, I can't hear very.
Apologies. What would it take for you to order a shelter-in-place?
Well, we're not using that term, first of all. Stay-in-place orders, we're seeing how they work in other states where there is much more congestion to begin with. Look, there are public health risks to people staying in place as well as public health risks to people not staying in place. We're weighing those, and it's a balancing act day to day. Want to see what people are doing, getting the word from the ground, seeing what people are doing and observing and hearing. If there are locales in particular that don't feel that they can be confined or shouldn't be confined and are taking advantage of the situation, we'll address that accordingly. But right now, I think I want people to enjoy life as much as possible. Within the extraordinary circumstances that we're dealing with in this extraordinary environment. And we've heard a lot of stories from other states in particular about crowded beaches in Miami and Fort Lauderdale and California, and people thinking that they're not immune because either they haven't heard the statistics or they're not understanding that the test results are just the tip of the iceberg, as has just been described. We have people who are ill from this virus of all ages, all age groups. We want everybody to be cautious and courageous at the same time. Yesterday I heard from a friend of mine whose granddaughter died yesterday in another state from the COVID-19 virus. She was 25 years old, a beautiful young woman, otherwise healthy. This can happen to anyone, anywhere. So we're asking the Maine people to continue to comply with our guidelines and our orders and mandates to protect all of us and to protect our healthcare system from being overburdened.
Would it be a matter of maybe if people aren't heeding those wishes strong enough? Would it be possibly like a matter of cases getting to a certain threshold? I mean, obviously every case is serious. Are those the kind of things that you're considering?
Well, I'm not going to speculate on what people might do because I expect them to do the right thing. They are, for the most part, right now, doing the right thing. We're reinforcing what we've said before. Dr. Shah is reinforcing it every day in these rooms, in this audience. People are listening, I believe, but I just want to make sure. Oh, somebody's on the phone. We just want to make sure, get the word out as much as humanly possible. What?
To the person heavy breathing on the phone, your line is open.
You said something about Paula Page.
Beatty's calling in from the Bangor Daily News. Sorry about that. Quick question is, if people are snowbirds or out of state, would you recommend they stay where they are, Mainers, or come back home? How do you think they should handle it?
Well, I guess it depends on how they're traveling in part, but we recommend, I think most states are recommending that people stay where they are, not travel, keep your activities as minimal as possible. It may seem like a secure, go ahead.
In other words, if I'm a snowbirder in Florida, I should stay where I am. I shouldn't come home early. I shouldn't. Should you stay beyond, or what's the general idea about traveling if you're normally away from here this time of year? Just keep doing what you do normally, or try to get home. What do you think of that?
It's a good question. I'm sure a lot of people, let's see, 6 months in a day, just about up. A lot of people are considering the ramifications of travel or not travel. Look, if you're safe where you are, stay where you are. Travel inevitably means contact with other people. You can't drive from Florida to Maine without stopping at a lot of rest stops. I know I couldn't. Or flying in a congested airplane. Or, Amtrak's not really working right now. So it inevitably means making contact, which we're trying to have people avoid.
Okay. Well, thank you very much for taking this call.
Thank you, Nick.
Dr. Shaw, I have a question for you about personal protective equipment. With the infusion of stuff today and the shipment from the federal government, how would you categorize where things are at in Maine hospitals and follow up on those handmade masks? I've seen a lot of folks wanting to make that. How effective are those? And I know the governor mentioned the site coming forward on connecting people to the right resources, but what should they do in the interim for that?
So the first question is around assessing the status of protective equipment across the state, and where are we? And protective equipment of this sort is used not just by hospitals, but as you noted, or as you could note from the figures that I provided, the bulk of the distributions that we made were to local level fire, EMS rescue, local level police departments, things of that sort. That's really who's getting the PPE right now. It's your neighbors, who we are starting our distributions to. That being said, we have, and Governor Mills has underscored the need for the federal government to increase the distribution of protective equipment from the federal national stockpile. Although what we've received is a good start, it's not where we need to be, and so we continue to urge the federal government to release additional stockpiles of protective equipment.
My understanding is a lot of the equipment right now has been focused on 12 hot spots across the country. We are not considered yet a hot spot, but that's where the equipment is being directed primarily. But we are receiving supplies now.
Governor Mills,
Hi.
as you're probably aware, the president has been making some comments lately about getting back to work and going to business. If there were ever a scenario where he makes that order, basically people that go about their business as usual, and that conflicts with the order you're just given, what do you do?
See, that's really speculative. Whatever he says off the cuff is not does not rise to the level of an order or a forecast or a prediction of substantive value.
Governor, you know the ongoing issue about that ironworks.
Yes.
Question of essential. Are the Speaker of the House and President of the Senate sending another letter to the congressional delegation, trying to push them harder to take action and push the Navy to allow the IW to close? Are you going to sign on to that letter or that?
Don, the congressional delegation has already written such a letter a week or so ago. They've gotten a response from the Department of Defense, which is not entirely satisfactory, minimizing that, not satisfactory at all. And I have talked with the Bath Iron Works management about precautions they're taking to prevent gatherings of people and close proximity, to prevent the typical congregation of workers coming and going at the gates during shift changes, to prevent break rooms being crowded, things of that sort, and providing sanitizing, hand sanitizers and hand washing stations at at regular intervals. Those kinds of things they're implementing. But I've also communicated with the Vice President following yesterday's call, because this is an issue that doesn't affect only Maine. It affects 10 or so other states. Other places where General Dynamics has business operations, places where their competitor, primary competitor Ingalls, has operations. Portsmouth Naval Shipyard, they're working in submarines, rehabbing submarines, pretty tight quarters. So I've asked the Vice President to ask the Department of Defense to look into all those operations and to modify the contracts with those entities, those private entities, to modify the deadlines and due dates of those contracts so that those entities, employing as many as like 6,800 or more in other states, so that they can allow some leave for their employees. And I'm asking the federal government to supply some funding to support leave that may be necessary to protect the health and safety of workers in those industrial complexes.
Going back to personal protective equipment for
Yep.
the state, Maine had purchased bulk millions of dollars of personal protective equipment and breathing assistance devices to prepare specifically for mass casualty events and infectious disease events with federal money. Where is that equipment? Do you guys have an inventory of them? And has All Clear Emergency Management, who you guys began contracting with in 2019?
What's the last part? I'm sorry.
Has All Clear Emergency Management, who you started contracting with in 2019, given you any advice on where that equipment is and how to distribute it? And then also, do you stand by Governor Paul LePage's decision to outsource that contract that was with the regional resource centers for 2 decades and now is with an out-of-state company?
I'm sorry, I can't answer the question about the contract. The rest of your question is really addressed to MEMA, who is responsible for inventorying all of our available equipment, and I believe they have done that. Pretty confident they've been doing that in close coordination with Maine CDC and with the federal government, with FEMA.
And Samantha, your question pertains to activities that were undertaken 2 years ago. Right now, our focus within Maine CDC and MEMA is getting the stocks and supplies of protective equipment that we have out to first responders and healthcare providers in the field. We'll get you answers to your questions, but right now, our focus is on keeping Maine people safe and the healthcare providers who take care of them safe.
But you are
Thank you.
waiting on federal supplies to arrive, so what happened to all the existing stocks?
Again, your question pertains to activities almost 2 years ago. And so right now, our focus is taking the supplies that we've got and putting them out there for healthcare providers and frontline workers. We'll make sure we get you answers to your questions.
Dr. Shaw, President Trump has talked about a cure for COVID-19. Can you talk about that? I've been pushing something to
He's on it. He's on everything. He's got tomorrow, the cure.
A cure is an interesting word. So in medicine, there are different degrees of treatment that we look for. And with something like a virus, what we look to do is to tamp down the amount of virus that's in the body so it doesn't cause the signs and symptoms of disease. There are a number of different clinical trials that are underway looking at different therapies that are out there. There was a report last week that unfortunately showed that one of the promising therapies, a cocktail that's used for HIV, the early report suggested it wasn't as efficacious. But there are 2 other drugs that are still being studied. One is a drug that's called remdesivir, that's also a well-known drug that's used in viral disease, and there are a number of trials, many of which are supported by the US government, that are underway. The president also referenced the potential use of another drug that's been around for a while called chloroquine, which is used in the treatment of malaria. As with a lot of these questions, they're great scientific questions, and as with most scientific inquiries, we won't really have a good sense until the data are in. But this is what the scientific community does, and that's what they're doing right now.
Dr. Shaw, we've seen over the past 2 weeks when a case is found positive here in Maine, but they're a resident of a different state that gets classified back to that state. Are those people still able to live, say, like in Knox County? And people want to know, like, are there people still living in their communities and they're classified in another state and the number might be lower, but those people are still there?
Good. So the question is, for individuals who are residents, full-time residents of other states, but who might be in Maine temporarily, who are diagnosed with COVID-19, how do we handle those folks? And the Maine CDC does what every other health department in the country does. We follow a national compact or protocol where cases are recorded for bookkeeping purposes for in the state of permanent residence of the individual who is infected. Now, that's really a bookkeeping measure. The public health measures are still undertaken by the relevant state health department for where they currently are. But the question or the concern that underlies this question is the idea that, gosh, if I only knew that someone were in my county, I might do something different today. I might take steps differently if only we would report on these other folks. And that supposition, that assumption is not true. Everyone should start behaving as if the virus were in their county, were in their city, and in their town. Even though your city, county, or town might not be on our board, you should think and go about your lives as if it were. Again, the absence of evidence in this case is not evidence of absence. And
The state has talked about trying to get more ventilators. Do you think that there are enough hospital staff in the state who can operate them, or do more need to be trained? And does the state have enough units where they can be operating like that?
good. So Caitlin's question is around ventilators and how we think about the need for ventilators and how we would operationalize that. And when you think about ventilators, you need three things. You need the ventilator itself. You need someone who can operate and optimize the settings on the ventilator. And then you need a place for that ill patient. So we're working on all three. The request that we've made from the federal government is for 300 additional ventilators on top of the 300 or so that we have. The other thing that we need are people to operate those. Right now, because of Governor Mills's recommendation to cancel or postpone all non-elective surgical procedures, we are working with the others that would have been involved with that, namely anesthesiologists, who are not in the OR right now with working on surgical procedures, but rather could be mobilized in quick fashion to help out if they were needed. And then the third thing is space for the ill people who require the ventilator. And so we're working with the healthcare systems, one, to assess the current number of beds that we have, but also look for ways in which beds that are currently not categorized as intensive care units could be adjusted to accommodate a patient with a ventilator. So we're looking at it from all sides. So, really, I think the way I think about this is that the ventilator itself is necessary, but not sufficient. We also need personnel as well as space, and our planning process is accommodating all of this.
I will also add that yesterday the Vice President asked all governors to take inventory of those ventilators that are not the kind that we're calling on right now, but that may be in existence in clinics and outpatient facilities, which are not now being used because of the restrictions on elective surgeries and appointments and procedures. And there are certain kind of ventilators that can be adapted because the FDA just approved a change in the vent that we can do with short-term training to make those ventilators available in hospitals for seriously ill patients.
Governor Mills, are you anticipating a point at which
Sorry.
you diverge from the federal government at all? And what I mean by that is, if the White House says something like we can open up the economy by mid-April, do we do that in Maine? What happens there?
That's similar to a previous question. I'm not going to speculate on what happens in May. We're taking this 1 hour at a time, 1 day at a time, holding our breath and being as patient and cautious as we can, and asking the Maine people to do the same.
Dr. Shaw, can you give us an update on Ocean View in
Oh.
Falmouth, whether any of the cases that were reported today include any folks from that facility?
So Steve's question is about an update for the Ocean View community in Falmouth, and whether in particular any of the cases that we've reported today are among residents of Ocean View, or the community members of Ocean View. Based on our investigation that's just started this morning, none of these new individuals is a resident of the Ocean View community. More generally, we continue to work with our colleagues at Ocean View. I think, as I may have mentioned yesterday, Steve, because of our concern for the well-being of Ocean View residents, I've asked my senior deputy to have a standing call with Ocean View on a daily basis to make sure that every single concern they've got, whether it's infection control, clinical management, protective equipment, is immediately routed to a senior member of my team for immediate distribution. Just earlier this afternoon, Our colleagues there had a quick question they needed an answer to regarding infection control practices and application of the CDC guidance. One of our medical epidemiologists was able to get on the phone with them very quickly. So we are maintaining a very open line of communication with them, given our concern for the well-being of those residents.
I have a question for Governor Mills about evictions. I know that other states have taken slightly more aggressive actions, but there are still writs orders that the courts put in place before this all hit, and they're still being enforced in some communities, including Portland. And I wondered if the state can do anything else to prevent that from happening.
I'm sorry, mixed orders? How do you mean?
No, they're writs. They're
Oh, writs. Writs and orders, oh, okay.
But they're still being enforced, we're hearing, in some communities. And I wonder if there's something
In the state of Maine?
Yeah.
According to Chief Justice Softly's order from a week and a half ago, I did not see that FED measures were part of the emergency operations that they were going to be engaging in with the public. But I mean, I could be wrong. I'm talking with the Landlords Association later today. We know that, among other things, the federal government has ordered that what used to be called Fannie Mae, Freddie Mac, will issue orders of forbearance on mortgages of landlords, property owners, conditioned on them forgiving rent payments related to the COVID-19 virus. I'm looking at evictions and thinking about them in different terms. Not all evictions are the same. For evictions related to non-payment of rent that is related to the COVID-19 virus, I will actively discourage evictions from going forward on those cases. There may be a number of other kinds of evictions for other reasons where people are trying to save their property. But sorry.
Governor's got time for one last question.
Oh, your time. How are you keeping the legislature abreast of things? I mean, obviously, we know they're not in right now, but I imagine many of them have questions about
Certainly.
finances, like what their plans are. Can you talk a little bit about that?
I spoke this morning for
Welcome, everybody, and thank you for being here today. I want to start out by saying thank you to Portland's City Manager, John Jennings. John and his team of staff at City Hall have been doing a phenomenal job working around the clock for all of us in the city of Portland, and I want to start with that because it's important, and I'm grateful. Spread of COVID-19 is happening in Maine, and a continued spread is inevitable. In Cumberland County, we have 74 of the 118 cases. We've got 16 in York County, which means that 90 out of 118 cases are in southern Maine. 76% of cases is in southern Maine. And while we're not New York City, we are Maine's most densely populated region. We need to act. We need to take this seriously, and we need to do this starting now. This is about social distancing. This is about aggressive caution. Why? This virus spreads person to person. It spreads between people who are in close contact with one another, about 6 feet or less, and it spreads through respiratory droplets produced when one infected person coughs or sneezes. And what we know, what data tells us, is that efforts do pay off. So what to do? We got to stay at home. This is about discipline for all of us. We need to exercise more prudence than we may think is necessary. And what that means for me and for my family is we don't grocery shop every other day. This is about spreading out your needs and making sure that you are responding to what's most essential in your life. We're looking for family contact only. We're looking for exercise that's a solitary event, not a social one. And we are about protecting healthcare workers and the healthcare system. These folks are a finite resource in Maine, and it is our job as a community to protect them. We want to avoid overcrowding at all costs. We want to avoid gathering. This is about behavior change. It's about discipline in the short run for the long term. I want to pause and recognize the impact that the cautions that we're putting in place have to businesses. The city manager and I talk a lot about the impacts to businesses and what this is doing to folks in the city of Portland. We're getting emails and phone calls, and we care deeply about the impacts to our local economy. But for now, we want to be taking our cues from medical professionals, from public health and safety professionals, and we want to look to the data, international data, national and local data, that tells us that our work right now is about prevention and containment. If we make aggressive, cautious statements now, if we act cautiously and aggressively now, the amount of time that we spend exercising these cautions will be lessened. And with that, I'm going to hand it over to our city manager, John Jennings.
Mayor, thank you very much. It has been a great privilege to be able to work with Mayor Snyder on a daily basis, particularly during this time. I also want to thank the City Council. What we're going to be announcing today is a collaboration between the Mayor, myself, and the City Council. I also want to thank the media. All of you are vital and essential in everything that we're trying to do to get the word out to the vast majority of the people who follow you. And I also want to just mention thanks to the governor. The governor made some announcements today. Our announcement today will take it a bit further than what she discussed earlier. So in working with Mayor Snyder and the City Council, I have signed a proclamation that continues the civil state of emergency in the city of Portland. The proclamation also establishes a requirement for all persons in the city to stay at their place of residence unless for essential services, as described in the proclamation. In addition, all businesses that do not provide essential services for COVID-19 shall close their physical workspaces and facilities. Businesses that do not provide essential services are encouraged to continue operations through remote means. We continue to encourage carry-out, delivery, or drive-through food service, as this is considered an essential service. This proclamation goes into effect tomorrow, March 25th at 5 p.m. for 5 days. The City Council will convene as a body on Monday, March 30th, where I will request an extension of the proclamation. I do not take this action lightly, as I understand the impact this will have on individuals and businesses. I am compelled to take this action as the positive cases in southern Maine continue to rise. We now have 118 confirmed cases of COVID-19, with 74 in Cumberland County and 16 in York County. It is our hope, by taking this action, many other cities and towns in Cumberland and York will also implement similar measures. We can flatten the curve in southern Maine if we act now. It is essential for everyone living in Cumberland or York counties to take this very, very seriously. I also wanted to just touch on a couple of other issues. Unfortunately, we had 2 employees test positive who work at our GA office. And so as of now, we've closed GA, the offices, to the public, but we are continuing to process applications. We are we have staff working in the GA office, but we are not allowing people to come into the building. We also had an additional police officer test positive as well, and so we have taken and put in measures at the police department, so that is 2 officers that we are aware of that have tested positive. We are reopening the India Street clinics next week for limited services as staff emerge from self-imposed quarantine this weekend. As I think you're all aware, 2/3 of our India Street staff had to quarantine when we had our very first employee test positive. So far, all of our employees at India Street, thankfully, have the ones that have been tested have come back negative. And so we plan to reopen the India Street clinics next week for limited services. Again, I just want to thank the mayor and the city council for the collaboration. I also want to thank city staff. This is one of the great privileges I have in my position is I get to work with an incredible group of people. They are out collecting trash. Our fire department is still responding to all calls. Our police department is still responding to all calls. Our shelter staff are working 24/7 because of the essential nature of what they do. And so it is a great honor to be able to work with such a distinguished group of public servants. So with that, I think I'd turn it back over to the mayor.
Well, and the city manager and I at this point would be happy to take any questions.
Mayor, why 5 days? Why only 5 days? And what is your definition of an essential business that can stay open?
So 5 days is the amount of time in our city's charter that the city manager can enact an emergency proclamation like this. And then we're required as a council to come in and decide whether to renew, amend, or extend. So when we meet remotely on Monday the 30th, starting at 5 p.m., this will be an order of business on the agenda. What was your second question?
Essential versus non-essential.
Yeah. So what we've done is we've created what's called an Exhibit A, which I think is online at this point. And so you can read through what the essential businesses are. But essentially they start out with things like grocery, pharmacy, healthcare, places where you'd need to go because you need to sustain your ongoing life. What it doesn't include is things like retail stores. And so I actually urge people to take a look at that list. It's, like I said, it's readily available, and we are not the first community to do this, so we've learned from what other communities have done and what works. This is, you can still go out for a walk your dog, but we are urging that these activities, these things that folks are doing are very, very careful and intentional. If you need to go to the grocery store, go, but if you don't need to go, don't go today. See if you can wait a few days. So what we really want to do, I mean, what this is all intended to do, and what I know the governor is doing with her work too, is making sure that we are doing everything that we can as a city and a region and as a state to slow the spread of this virus.
Mayor Snyder, and if you don't mind repeating the question for those at home, they can hear us. What is the city going to do to help homeless people who are out this 5 days and further?
Yeah, so the question has to do with what the city is doing in response to folks who are homeless, who are experiencing homelessness at this time. And I'll ask the city manager to come in, but rest assured, as the city manager said, shelter staff, the city of Portland's Oxford Street shelter and family shelter staff are working. Those facilities are open. And do you want to talk a little bit more in detail about how the staff is operationalized?
Thank you for that question, because that's a very, very important question for our community. So our city staff is continuing to operate Oxford Street. It's a 24/7 shelter, as you may know. We're continuing to operate the family shelter. We are still receiving families who are seeking asylum. So that also adds to the amount of work that we have to do in terms of the shelter, the family shelter side. The one thing we have done, because we feel an enormous sense of responsibility as a city, is we have moved some of our families into motels to empty out one building, which will provide 12 units up to 36 individuals for quarantine purposes and or isolation. So isolation after someone's been tested, quarantine if they test positive. And so what we have done, we've had 5 or 6 individuals who have been isolated in this facility. And thankfully, again, all of those individuals have come back negative. And so the city continues to operate all of our homeless shelters. We have also been working with the state and to potentially open up other facilities in the area. And so that is ongoing work, and I think more information will come from the state in just a day or so.
John, could you maybe go through one more time in specifics how the Portland, but do business and come here for things. Just talk about that if you could.
Yeah, absolutely. So I was in conversation with the governor's chief of staff earlier today, and of course I think we all know all of this changes by the minute, if not the hour. And so I knew that the governor was going to be making certain announcements. What we have done, though, is we've taken it a step further in terms of the stay-at-home order, and that is specifically targeted at the residents of the city of Portland. The mayor, I think, did a very good job of underscoring the urgent nature of where we are. I mean, I think it's been said on television, I think we all need to function as if we have the virus. And that means that we quarantine ourselves, we keep our distance from others. You know, if you want to take a walk on the Eastern Prom Trail, you stay a certain distance, but recognizing that every single time we can put others in harm's way by our actions. And so I think that is the reason why we went to that another step of the stay-at-home order, because it is so vital. And the other part of this is, and I think we all know this after several months now, is if we can get on top of this, particularly in southern Maine. There are 6 counties in the state that do not have a positive test. And I understand what the governor is doing, because there are those 6 counties that have not had any impact whatsoever. But in southern Maine, the vast majority, as the mayor said, the vast majority of the positive cases are happening right here. And so for us, we have to take even further action. And that's why we're kind of asking other cities and towns to join us in implementing many of the measures that we're proposing today.
So people will be able to drive if they need to, they'll be able to be outdoors, they'll be able to go to a convenience store or grocery store. What activities do you want them to stop doing now that they can do, let's say tomorrow before 5 p.m.?
Well, so for instance, people can do those things, but only for essential services. And we have those completely listed in the attachment, as the mayor said. You know, in terms of what they should do between now and tomorrow at 5, they should act as if it is 5 o'clock tomorrow, and shelter in place if that's necessary, meaning stay at home, and also do the bare essentials. I mean, as the governor said earlier in her statement, you know, this is not business as usual for any of us, including city staff. I think you all know by now that we have closed all of our buildings. Only essential staff are actually working in physical space. All of the rest of our staff are working remotely. And so for us, this has been a trial, to be honest with you, because this is not something we, or any of us, anticipated just 12 days ago. And that also leads to the other topic, which I did not mention, is the city budget. And we are, in all candor, in a completely different world than what we were 12 days ago. We had actually put together a very good budget for the taxpayers of this city. And unfortunately, what we've seen over the last 12 days has been a complete collapse in our revenue projections. The Jetport, for instance, I mean, they're down over 80% at this point. Parking is down. And you just go across the board of all of our revenue areas, we're down. And so what we have to do as city staff is essentially start all over from a budgetary standpoint, and we're prepared to do that. But it now is not the time to focus on a city budget. The governor has given us leeway, and the legislature has given us leeway. And so for us, we're dealing with the emergency side of this. We'll get to that eventually, but there's no urgency to have to do that right now.
John, what do you advise folks who come to the GA office to do now that it actually is closed?
So with the General Assistance Office, please call. And what we're doing is we're accepting paperwork via a window. No one can come inside, but we are accepting paperwork via a window at our Lancaster Street office. We are going back and forth with questions via the phone. But then we also are doing a distribution of general assistance vouchers and funds via that same window. So it's people are still coming to the office, they just cannot come inside. But we also recommend that they do as much as they can over the telephone, because the in-person, which is the way we traditionally always do general assistance, the in-person part of general assistance is closed.
What's the total tally of police officers that have tested positive, and any change in procedures on how that department's operating?
We have 2 officers that have tested positive, and there are no change in terms of procedures for the police department. However, we are making sure that we are keeping the police chief, Chief Clark, is keeping an eagle eye on the rest of the department, as is Chief Gautreau with the fire department. I mean, that's our frontline defense. And so it is critical that our fire department and our police department, as well as our shelter staff, are well taken care of.
John, any restrictions on people moving at the end of the month? Changing apartments or moving?
I think I'd ask the mayor, because the mayor actually, so the question is are there any changes to the housing procedures here in the city? The mayor issued a press release to that effect yesterday, and maybe you'd like to speak to that.
So there's nothing in the city manager's emergency proclamation that prevents people from moving. If somebody is scheduled to move at the end of the month and they need to do so, they can do that. The press release yesterday really focused on communications about how landlords and tenants are communicating in terms of things like evictions, rent increases. We're getting a lot of folks reaching out to us asking about what protections there are for tenants. And what we're emphasizing right now is the importance of tenants and landlords speaking to one another. And as a city, we're urging no evictions. They're not happening in the courts anyway, but no evictions for 90 days, no rent increases for 90 days. Basically an environment where people can stay in their homes and we can weather this crisis together. So, but it doesn't impact somebody moving if that's what they've already planned to do. I think that really what we're trying to do here, and as the city manager said, this is a stay-at-home proclamation. This is about getting people to think and behave differently and to restrict their movement, really, beyond their household. And so to be very, very conscious and thoughtful about what it means to leave your family environment. Those are the folks that you're interacting with and sort of exposed to, right? So we're all exposed within our home, but we want to limit that exposure beyond our front door. And that's really what this is about.
Getting into the details here, the city has stopped issuing ticketing for,
Yep.
for cars. Is there going to be a change made as far as trash bags as well? People are wondering.
That was one of the things that we wanted to talk about. So I'm going to let the city manager answer that question. But I will say that we have gotten a lot of inquiries about those purple trash bags. But let me say they are available in the stores. They are available on Amazon. But we do recognize, especially for folks who are saying, I don't want to go out to the grocery store today. I don't have a bag in my house. What should I do? So let's hear it from him.
Again, thank you for that question. It's probably one of the questions we've received the most emails about. So as I just mentioned, our revenue projections in the city are going down, down, down. And so what we've tried to do is maintain those areas in which we could still operate essential city functions. But with that said, so we still want to encourage people to buy the purple trash bags. But for a limited time, and I want to stress this, for a limited time, our solid waste department will be collecting trash in different types of bags. White bags, black bags, you name it. So, but I do want to stress this is for a limited time. We understand that there is a great difficulty. And this is, I tell you, this has been the most difficult decisions that I've ever had to make in my life, because I uniquely know, having grown up in a family with a single mom who we live paycheck to paycheck, and I know how difficult this time is for families, for individuals, and then for us to take this a step further and close all businesses and really put in jeopardy those businesses, but because of the important health aspects of this. So I understand why people are asking the question. That's why we want to give some leeway at this time for people to use whatever trash bag that they would like to use. We'd like to encourage them to continue to use purple bags, but if that doesn't work, we'll still pick up whatever's left on the curb.
Question for John. It's early, and this is not the time to go into details, but early numbers about budget impact. Percentage-wise, can you just talk about a ballpark reduction in revenue at this point?
You know, it would be very difficult for me. I mean, we're 12. I kind of count 12 days into this right now. It would be very difficult even to give you a ballpark. I will say that we had done a fantastic job in working with the mayor and the city council to get to a budget where it was only a 1.6% increase, which was really where we as staff wanted to be. And give the city council and the mayor a budget they could work from. We also know the impact that taxes also have on families and individuals who live in our city. We have suspended collection. We've suspended the deadline until June 1st for property tax collection, as I think we all are aware at this point. But it is a difficult set of circumstances to think about. Just 12 days ago, I was very, very happy about the budget that we as staff had put together and we're going to present to the council. But now we have no idea. We have no idea. But I will say that it doesn't mean that the city staff, and I would let the mayor speak for the council, that we're going to go look at a large tax increase. Because it's just not in the cards for people, particularly during this time. So we're going to continue to do our best to have a minimal increase, but that will also potentially impact services. So that's the trade-off that we'll have to look at some point. We're not quite there yet.
Yeah, just to add to that. We don't know what the impact of this is going to be. We expect it will be long-lasting, and although we've been through recessions before and economic hard times, we can't quantify what this is. And so, as the manager said, first things first. Right now, we are focused on public health and public safety. This is the most important thing, to keep people well, by keeping people distanced. So our focus is there. When it comes to next steps in terms of budget, there are so many important things to consider, the things that people rely on from city services, but also how people are making their way through the days in terms of their paycheck and their ability to pay taxes and to contribute. So those are all things that we will get into when the time is right. For now, let's keep our focus on keeping our community as safe as possible. So, seeing no more questions, do you have a question, Phil? Thanks again, everybody, for being here. I'll just reiterate that this is a stay-at-home order. This is the city of Portland asking people, telling people to stay at home unless you have essential business that needs to be conducted. We are asking you to exercise outside if you need and want to, but do it in ways that are not overcrowding the Back Cove Trail or even your neighborhood. Some of the concerns that we're getting through email have to do with those everyday things like the purple trash bags, the crowds on the back cove. When can I get my groceries safely, right? So we're asking for folks to exercise caution, exercise common sense, and take it a step further. And again, if we are able to be aggressively cautious as a community now, our hope is that we can flatten the curve in the state of Maine, in Cumberland County, in the city of Portland, and that we can start to recover from this virus sooner rather than later. As we said, the council will be meeting on Monday at 5 p.m. Our intent is to take up the emergency proclamation and look to renew it. So thanks again for being here, and please stay home.
And that wraps up the briefing of the City of Portland with Mayor Kate Snyder and City Manager John Jennings. Just to recap what we've heard over the last 90 minutes or so, we heard from Governor Mills in Augusta, who is ordering further steps to protect public health. What was a recommendation a week ago is now a mandate. She's issued a new executive order that mandates that all non-essential businesses and operations in the state of Maine that require in-person contact or are public-facing, that those non-essential businesses close. She's also urging that essential businesses take steps to limit the number of customers who are allowed in a store, in a supermarket, for example, to enhance curbside pickup and delivery services, and to implement physical distancing measures to protect both customers and employees. The City of Portland, however, is taking things a step further, and that is to issue a stay-at-home emergency order, which is effective tomorrow at 5 o'clock, but the city manager urges people to do it right as soon as possible. And what it means, it has measures that apply not only to businesses, non-essential businesses that must close, but that residents must stay at home except to take care of essential businesses such as food shopping, going to the drugstore, that sort of thing. And the reason the city manager is hoping that more towns and cities in Cumberland and York counties will follow suit, because it is in these counties where the preponderance of Maine's 118 confirmed COVID-19 cases are. We will have much more about all of this coming up on News Center Maine beginning at 5 o'clock, as well as on our website and mobile app. We hope to see you coming up at 5.